Remember, this is the big needle.
Tell me when you're ready we can start.
What did I do with it? Oh,
I thought it's already started. Oh, the audio.
We've recorded, but we haven't introduced ourselves where we are.
Oh!
Hi. Welcome to
Big Sky
Natural
Natural
Health.
Health.
Welcome to Natural Health. Today we're torturing Joe for fun.
Yes, we are with Kaley Burns. And she runs Big Sky Natural Health here in Town Center. How long have you been doing this, Kaley?
I've been in Big Sky about 2.5 years, but I've been practicing for almost 8.
Okay.
Yeah.
Very nice. I assume you like it here?
I love it here.
I have do you want me to go ahead and start asking my questions at this point?
If you want to. I
I
just
have
want to
some
start by
Put
saying
cream
it.
on your head.
Yeah.
Your
do
office smells amazing.
It always
get that a
does.
lot.
I love to come in here sometimes and just get stuff done because it's a good focus place. What do you think? His little arm. I mean, maybe this one. It's more of an
Whatever you
artery
feel
though.
best, I think.
That one.
Maybe we can preface by saying Michelle is trained in phlebotomy.
I am a phlebotomist.
I don't
but
just let every wife draw their husband's
yes,
blood.
I'm a phlebotomist and starting the accelerated nursing program in fall. Hopefully, fingers crossed. But yeah, your veins usually pop better than this, Joe. I don't know what have you been
Are you
doing.
dehydrated?
Did
I
you
don't
not
know,
drink
sorry.
any water today? I bet you didn't.
I've been drinking water.
Always drink water before a blood draw.
I'm sorry. I should have.
You're gonna make me stick an artery. I may go far
Overhydrated.
left. I may go far left.
What?
I think that's the best one.
So
Yeah.
let's talk about this process that's happening right now. What is this called?
This is called venipuncture, or more commonly known as a blood draw.
Okay. But in the larger scheme, this is
But
a
our goal with this is PRP.
PRP.
Yes.
Which stands for
Platelet-rich plasma.
platelet-rich plasma, and you're gonna pull that out of me.
Yep.
But then,
We're gonna draw your blood.
okay.
Did I fill this whole
And then
thing? I
we're
forgot.
at 25. And then we are gonna spin it in a special centrifuge. And the red blood cells are heavy, so they sink to the bottom. And
It's
then
all
we
right.
have
Little stick.
beautiful plasma portion.
I'm sorry, babe.
Where we get all kinds of growth factors and immune cells, and we are going to apply it to your
Wait,
wonderful
it's not coming out.
head here,
Oh,
and we're
bless.
going to help with hair growth.
Is it most commonly for
Most-
hair growth?
Actually, most commonly it is orthopedic use. So,
Okay.
a lot of knees, a lot of shoulders, a lot of low backs, and then the other really popular thing now is the vampire facial, which is technically a PRP facial.
I'm gonna do this
Okay.
with my teeth because it's my husband.
Oh, what is happening?
They do not teach you that one in school. Oh god.
I was like, wait,
That was
I need
good.
a little bit more
That
flow.
was like a pro tourniquet maneuver.
Yeah,
right
I
there.
knew exactly which one to pull
Awesome.
on.
That's great.
If it was a patient, I would have, We're almost to the
You're
30.
good. 25.
Oh, okay,
Good.
cool.
Yep.
I'm going to use the rest on my face. See what happens. You're 2 years younger than me. There we go. Check your breaths a little extra. I'm not going to lie.
And then
No, that's a lot of blood.
I'm gonna have you to go like.
How you feel? You good? You
How
think?
many cc's is that,
I'm gonna
Kaley?
stick your-
This is 30 cc.
30 cc's of my
Yeah.
blood. In that
Right.
syringe? What is that?
Yes. Now I have to go spin it.
Yeah,
Sucker
check-
device?
Check, I may keep you out there. Your breath smells like your food.
You're good.
which
You
is-
can move.
it's got
Oh,
alligator
okay.
in it.
Okay, so how long did that take? Was that 10, 15 minutes, something like that?
About 10
Okay.
minutes.
Who's good, this one? He's a good boy. Yes, and Kaley and I, we caught up because she is our town naturopath, but she's also one of my really good friends.
Oh, yeah.
So,
A little girl talk. happening.
yeah,
Okay.
girl talk, life talk, also just, I don't know, medical talk, which is something we geek out on. I think
Yeah.
the first time we met, we were running together, and we kind of broke off because we were the fastest.
We just ran away.
We just ran away. And then all of a sudden I was like, wait, you're a naturopath? And I was like, wow, I'm going into be a nurse practitioner after dealing with naturopaths over the years and loving what they did. But see, the difference is I want to do some medical stuff. Like, I grew up in an emergency room. So Kaley probably doesn't want to stitch people up for a living and things like that. It's not as much. Okay, so I have some questions I prepped, and I know the answers, but not our listeners don't know the answers to these questions. So what made you want to become a naturopath?
Ooh, that's a great question. Well, I actually was going to become a physical therapist, and I've always been active, endurance sports, all that fun stuff. And became quite sick with my own personal health issues. And as sort of a last resort of not getting better and getting a lot of medications, I went to see a naturopath who helped me to figure out that I'm celiac and turned my health around in a couple months. So I withdrew from PT school and started my path of naturopathic medicine.
Yes.
Very cool.
Yeah.
And can you just explain what you're doing as you're smearing things into my head?
All right, I'm going to do some
We
video from here,
are
too.
rubbing off the numbing cream. So we're
Okay.
cleaning everything before we start injecting.
I got
them.
it. Okay, so that's why it smells so
So
strongly.
we
of
put
alcohol.
some-
Yes.
We put some lidocaine
Beautiful
on there.
alcohol scent.
Now would not be a good time for me to light up a cigarette.
Most likely not.
All right.
It's not enough alcohol. Although, Smith
We're
made a
talking
video the other
isopropyl
day.
here. Okay.
Yeah. So, yeah, that's another thing we bonded over, both of us
And
being
you're-
celiac.
Yeah.
Being celiac, that's right. And you're prepping my scalp to start injecting the
Yes. Oh, do we
platelets
want
back
to show
into my
people what
head.
it looks like?
Yes.
Oh,
So
ooh,
this is
I haven't
liquid
used-
gold. This is the platelets. So we spun it for 10 minutes. No, 15 minutes.
4 minutes and then another few minutes just to get it to. Basically, we're trying to make it so it helps stimulate growth.
Are there no red blood cells left in that?
There are not. We extract them all away.
Okay.
Red blood cells are just inflammatory, and we don't want it to be any more inflammatory. than
What'd you do
that
though?
is.
You just feed those to the dog?
Yeah, Chuck loved it.
He's going to be superhuman.
That's why he's smiling. so much.
Iron-rich diet in that.
Yes, it's good for the liver.
dog. Oh.
Yes. Okay, so I have another question.
Yeah.
What do you do in this practice that you think benefits people's lives the most?
Oh, I love that. I think it's really about our relationships with people. That's just something all of the practitioners in here strive for, is to really create a partnership, and we're here to empower and educate people and provide that support and accountability to help optimize health. So even if we're, giving supplements or we're doing acupuncture, we're doing PRP, whatever we might be doing, to me it's also about all that interpersonal relationship, someone you can trust.
Yes.
I
Yeah,
think that's the most actually powerful thing that we do.
I agree. And like a lot of times when I'm here, I mean, you take calls on everything over the rainbow from your patients. People are just like, I feel a little off today. My emotions are all over the place. And as a naturopath, you kind of know how to address it, internally, instead of, oh, let's give you medicine for what you're dealing with. Let's really figure out why.
There's always an underlying cause.
Yeah. I love that.
What is the
That's what I love
ratio,
about it.
would you say, of inpatient? Is that what you call them when they
I'm
come to
gonna
the
stop
office?
In office?
You're not going
In
to love that
office.
angle,
Yeah.
Joe, but
Right.
Kaley, you'll love it.
I'm used to having bad angles, okay. But what's the ratio of in-office versus like house calls?
I would say we're probably 80% in office.
Okay.
I probably do more house calls than anybody else in the office, but I'd say at least 80% in office.
Yeah, you have a lot of people that
Are
do
you
this.
ready for this?
I'm ready.
Excellent.
Yeah.
This
Let's
is
do
the
Nice deep
this is the
breaths.
second time we've done it. The first time Kaley and I did the injections, we split off. We made
This
it
is the
half
third
seats.
time in here.
Is it?
Yeah, one time it
Kaylee
was just
did
me.
one by herself.
Yeah.
Oh, I
And
forgot about
that. This part,
it's not your favorite,
it's like wasps just stinging you
Sting.
really slowly.
but it's worth it because.
Oh yeah, it's all
So
about
here's what people ought to know
the
is
hair
that
regrowth.
is that Joe would probably go bald if it weren't for me.
I'd have a mean widow's peak at the very end. I would have some. What do you call those, alleyways?
Yeah.
I would have those.
You definitely have those.
Kicking.
And then in the back middle area. But yeah, I was just like, hey, you
that
can do
is-
something about it.
yeah,
And PRP works.
Something that is truly, truly painful.
Yeah. But I have also had PRP, which is something that Kaley does with her patients all over the body.
Yes.
And when I say all over the body, I mean I got it done in my nether regions.
Oh, in the area that shall not be named.
I did. Some women do it for incontinence,
Mm-hmm.
but I did it because my uterus was was tired of the small space it had been living in after having children, and it wanted to move on in.
Excellent description.
Yeah,
Did it feel like this?
It wanted to prolapse.
But down there?
It's actually not as bad as it sounds.
No, it
I think
actually
it's way better.
I know. And Kaylee and I had a whole new level of
We
friendship
are very
that day.
good friends.
Yes,
That'll
I
bond
was
you.
like, so anyway, but it was fine. I think once you're in medicine, it's like everything.
And it's been helpful, yes.
Oh, it's been incredibly helpful. Like, it changed so much. I didn't realize, like, the prolapse was helped. It firmed up that wall, but it also helped our sex life.
Yeah.
Not that our sex
Yeah.
life was bad before, but like
It's a real thing.
it brought back even more sensation. I was like, whoa, I'm back in my 20s.
I'm not sure if this is helpful right now.
Oh,
What
what?
I'm going through, and then
For what I'm going
I'm having an experience here.
You're doing so great. Are
This-
you
Okay.
breathing? You gotta breathe.
Well, I'm breathing.
Forget to
I'm
Okay.
breathing. I imagine
So
like people who get tattooed and who cut themselves to just feel something. I wonder if this is a similar sort of moment that I'm having now. Right? I truly feel life.
You can thank Michelle for all these.
We're supposed to be
sensations.
doing questions right now, Jay.
Okay, do questions. Do
All right.
questions. I don't have any
So-
questions. All my questions have been answered.
So my other question is, there are a lot of injuries in Big Sky.
Yes.
What is one you see the most of, and what is your treatment for it?
That's a good one.
I have fun making questions.
That is a good
I
one.
know.
Whew, injury. I would say any kind of like overuse type injury is pretty common.
Like rotator cuff, things like
Yeah, rotator cuff, knees,
Joints.
basically joints in general. But yeah,
Show
and
me
then
joints.
a lot of low backs.
that.
Uh-huh.
Yeah.
You get a lot of low backs, SI
Makes sense.
joint.
It's an active community, not
Yeah,
just
which is
skiing,
awesome and
everything.
it's great. But there's a whole lot of things that we can do here, from cryotherapy, which is basically a cold therapy, to acupuncture, PRP, cupping. There's all kinds of nutritional regimens, supplementation. A lot of people don't tolerate NSAIDs very well. It starts to kind of get after your stomach a little bit. So
Mm-hmm.
we have a lot of options.
I know all about
Yeah.
that.
What's your least favorite treatment to give people?
Are you hoping I'm going to
She's
say
gonna-
this one?
She's gonna be vaginal. Michelle's vagina actually was my least favorite.
There is one specific moment I can remember.
I love everything I do. I really don't have a least favorite.
Okay, that's
Even
good.
things like this, like I know it's uncomfortable and I apologize about that, but I know
Yeah.
it helps. So
Yeah.
it's reassuring to me to keep going.
Yeah.
Like I know it makes such a big difference for people.
Does.
Totally, yeah. And then-
No, I mean his friends. I think
Much
after
more
the first
painful.
time he got it done, they were like,
Yeah.
"Did you do something different? Did you get hair implants?" And I was like, "No, just
Better.
treatments forced by his
it's
wife."
crazy that it can work. That you don't have to
Yeah.
get plugs or.
Your own blood and your own body are so powerful. It's really exciting.
Mhm.
Yeah, I don't need Rogaine or some
Yeah.
crazy chemical to
Right.
be in my scalp or my.
Right. That causes
Body.
other issues. We don't need that.
Okay, so you have a lot of patients that come to see you.
You're doing
She
great.
guys,
We're
she
almost
works
Thank
like
you. Yes, I'm taking deep breaths.
yes.
Very good.
Kaylee works like 7 days a week, a lot of times because she is so busy here in Big Sky. But what do you think that patients like the most? Like, what has the most impact on a patient's life? What is there a supplement or a treatment or something that you do with patients where they're just like, this has changed my life?
Gosh, it's so different.
You do
for
so
everybody.
many different, right?
Because our care is so individualized, so it's hard to for sure say. But I would say a lot of the nutritional things. So
Yeah.
we do food allergy testing, also
Yeah.
food sensitivity testing. But a lot of it's just getting to the meat of like, what's your barriers? How are you trying to optimize your health?
Mhm.
And I love talking about nutrition. I think all of us love talking about it, but it's the foundation of your health. So it just makes such a big difference in terms of any kind of supplement or therapy or anything we're going to do on top of this. So even if I was doing PRP to somebody's joints, we're going to talk about what they're eating because it's going to make their injections more effective too.
Right?
So.
Inflammation.
Yeah.
Would you say
And-
that's like your overall message to people? If you could tell them one thing, would it be
It's
their
what they're
diet?
eating. Yeah,
Okay.
for sure.
Yeah.
And kind of to piggyback on that, their relationship with food is another big one. I think we're told a lot of different things, or we hear a lot of different things, and the more you love what you're putting into your body, the even more nutritious it can be for you.
Okay. What's the?
She doesn't chide me so much for my sweet tooth because I couple it with good things. Also, on the whole, I'm like a happy, well-rounded person.
Every nutritional post I put up, Michelle's like, but M&M's too. I'm like, yeah.
I know. I mean, definitely in moderation.
Well-rounded.
Yes,
sure.
well-rounded, and I definitely need to moderate it. But I do think that stress levels are important.
What's the most common mistake people around here make when it comes to nutrition?
Well, almost everybody's dehydrated.
Okay.
But aside from that, I would say sugar is probably the biggest kind of battle that I face with most people.
Okay.
It's so addictive.
Yeah, and it's in everything.
Yeah.
And you have to kind of become a label reader on everything that you buy or get, and yeah.
More water, less sugar.
Yes.
Okay.
More water,
Well
less
said.
sugar.
So I'm gonna, just for the sake of everybody, we're now putting on a platelet pour serum. So it just helps to kind of seal everything in. It's kind of cooling. It helps kind of anti-inflammatory, everything we just did. But usually it feels pretty good. And that's kind of like the final thing. And then we're going to ask Joe not to wash his hair for 4 hours.
Yeah.
Does that mean we're done with the needles?
Yeah.
On my scalp? Oh, thank God.
Did it.
Oh.
So yeah,
good.
there's platelet rich, and then the platelet poor stuff is the stuff, once you spin it, it's in the middle area, right?
It's actually the very, very top.
Oh, it's the very top.
Yeah.
Yeah, the middle's the good stuff.
Yeah,
The
all
top
that
is
yummy
the
stuff is in the middle.
fun
And you're
stuff.
going to look like you have amazing hair gel right now. So
Yeah.
it's really good.
Okay, so this is a fun question. What is the unhealthiest thing you do? Because you to me are
That's a
like
really
the
fun
epitome
question.
of health. You're like so good. Even after like long runs, you're like, I'm gonna drink bone broth because I know that's good for my joints. Meanwhile, I'm like horking down donuts. You're like, you.
I could probably use more yin things in my life. So I'm trying to, after running, I should do a little bit more stretching, recovery style things. My latest thing I'm really trying to work on, and I try to work on this with everybody, is actually relaxing and chewing and eating and enjoying your food. Because a lot of us are running around all the time, and I'm super guilty of it. So I think that's a big one for me, is kind of more chill time. And
Yes.
I can still run around and see patients 7 days a week, but if I get my chill time, it's all good.
Yes.
Yeah.
To do
Yes,
that,
you are
though,
very
you gotta
fast-paced.
eat food that's good. You can't eat crappy food.
Exactly.
So I think that's good advice.
Okay.
I like that.
So, do we want to? By the way, we can edit whatever.